Hospitals in central Indiana are being overwhelmed by the rising number of coronavirus cases.
Hospital staffs have been decimated by the virus, and ITMate's Richard Essex is told that many hospitals are near a breaking point. Richard.
The Indiana Hospital Association is sounding the alarm. COVID-19 hospitalizations are at a record number. The number of people on ventilators is also increasing every day, and PPEs are starting to become in a short supply, and hospital staffs are being hit by a record number of positive cases. I talked to Dr. Christopher Dorian, the medical director at Franciscan Hospital here in Indianapolis. He told me that their supply of PPE is starting to tighten up, and they are doing everything they can to make sure that it lasts. Franciscan has experienced a six-fold increase in COVID-19 patients in the last month and a half. 5% of their medical staff is either out on quarantine or sick with the virus. Now, 5% may not sound like a huge number, but they, like a lot of other facilities, don't have a ready reserve of people standing by. The Indiana Hospital Association told ITMate that hospitals in northern and southern part of the state are being hit the hardest right now. Many hospitals are at capacity and are forced to send patients away. Staffing remains the #1 issue at all Indiana hospitals, and some hospitals are considering using medical staff that are asymptomatic to treat COVID-19 patients.
The CDC says that is something we should consider in a crisis, and I think we are nearing, if not in that crisis. But that does require, even with COVID patients, you've got to have a lot of PPE. It takes additional cleaning of those sites.
There are not any hospitals currently here in Indiana using asymptomatic medical staff to treat COVID-19 patients, but if staffing crisis continues, it could be something that hospitals will have to consider down the road. Now, hospitals are also anticipating this current surge to last at least several more weeks. In Indianapolis, Richard Essex, Wish TV, wishtv.com, and follow us on Facebook.
All right, Richard, thank you very much. Well, the state health department is reporting 2,951 people have been hospitalized for COVID-19. The department is also reporting 5,500 new positive cases in the state, meaning there have been more than 262,000 cases here in the state of Indiana. The report also adds 84 deaths. They happened between October 22nd and November 16th. More than 4,700 people have died since the state began tracking the pandemic numbers.